welcome. In this video, let us look at the pathogenicity, clinical features, lab diagnosis, etc. of Taenia. Taenia. We always call it Taenia because it's tapeworm. Taenia is fungal. Taenia is fungal ringworm infection. So don't get confused between Taenia and Taenia. Taenia is tapeworm. Okay. So it's a cestode. It is also called tapeworm. It is cyclophilidian tapeworm. Okay. So in the last video, we looked at where exactly it sits. It comes under helminths, under cestode. They affect the intestine. So they're called, they're under this. There are two varieties, Taenia saginata, Taenia solium. The larva of Taenia saginata is called Cysticercus bovis, and the larva of Taenia solium is called Cysticercus cellulose, and it causes this cysticercosis, which is the tissue infection from this Taenia solium. Actually, it is the larva which causes cysticercosis. Okay. So all the things in green you are in yellow you are understanding, right? That is what we are going to cover in this video. Taenia saginata, Taenia solium. The larva of Taenia saginata is called Cysticercus bovis. That is not causing cysticercosis. Cysticercosis is caused by the larva of Taenia solium, which is called as Cysticercus cellulose. Okay, moving on. We saw a high-level view of Taenia saginata. Basically, it is a common large ribbon-like tapeworm. It is called as beef tapeworm because it comes from beef, eating uncooked infected beef. So basically, in this you can see Taenia saginata, there is no rostellum and hooks. They are absent here. You can see in Taenia solium, you can see the rostellum with hooklets. Hooklets are 2 rows. Oh, right? Taenia saginata is bigger than Taenia solium. Taenia solium is small, but it has hooklets. So it is armed. Small but armed fellow. Smart fellow it is. Now, this Taenia saginata, 1000 to 2000 proglottids with dichotomously branched uterus. So basically it has 1000 to 2000 proglottids. Proglottids are the reproductive structures. Okay. So Taenia saginata has lot of proglottids. Now coming to the definitive host is man. Intermediate host for Taenia saginata is cow. How will the person get infection? Because of eating uncooked infected meat, that is beef containing Cysticercus bovis larva of Taenia saginata. Eggs are not infective to human. So Taenia saginata, though it has so many proglottids and so many reproductive structures, the eggs are not infected to human. In fact, the good thing is if there are adults in the inside us, right, they usually don't cause any problem. All problems are caused by larvae only. Okay. So how will you diagnose any issue with Taenia saginata or Taenia solium? Because you will detect the eggs or the proglottids in the stool. You will do serodiagnosis, that is serology. You will do molecular diagnosis. We'll come to the details. Treatment is praziquantel. Praziquantel is the drug of choice. In cysticercosis, excision is the choice. But cysticercosis is not caused by Taenia saginata, so they should not put it here. Praziquantel is the drug of choice. Prophylaxis, don't eat undercooked beef. Nowadays, you know what happens? Earlier they used to say Annadato Sukhi Bhava. Now it is like the person who gives clean and fresh food, that guy is Sukhi Bhava. Annadato they are ready to give. They'll take money and they'll give stale food. Nowadays it is like clean food, deto Sukhi Bhava. Okay, let's move on. Taenia solium. Taenia solium here, it is called as pork tapeworm because it is coming from undercooked infected pork, which comes from pigs. So basically, Taenia solium are smaller than Taenia saginata. They have rostellum, they have hooks. So they are called as armed tapeworm. Though they are small, they are armed. They have lesser number of proglottids. Okay. The definitive host again is man. Intermediate host is pig. In case of cysticercosis, intermediate host is again man. Infection happens because of eating undercooked pork containing the Cysticercus cellulose. Okay. Here the eggs are also infective to human. There can be auto-infection Even a vegetarian can get this disease because even contaminated vegetable food, water can affect us. Clinical features, adult worms are very good, they won't cause any symptoms, but the larva will cause issues. Here what happens, the larva, they cause cystic lesions, okay? They can cause neurocysticercosis, etc. So remember, cysticercosis is caused by the Cysticercus cellulose, right? It's the larva of Taenia solium. The diagnosis, same thing. You will check in the stool for eggs, proglottids. For cysticercosis, you can do biopsy, X-ray, CT scan, MRI, serology. We'll come to the details again in this video. Treatment, praziquantel, etc. For neurocysticercosis, you may have to give anti-epileptics also. Prophylaxis, again, eat good cooked food. Don't eat raw vegetables, etc. Moving on. Life cycle we have seen in the last video. We saw that man will eat the pork, right? This arrow I forgot to write, wait. Okay, so we have drawn the arrow. So man is eating the infected undercooked pork, and then in his small intestine the scolex exvaginates and anchors to the small intestine. The adult worm in small intestine, this is the gravid proglottid. So the gravid proglottid will be passed in feces. This can cause auto-infection to us itself, and also if it is contaminating water, food, etc., then this is going to be the oncosphere. Oncosphere will become the Cysticercus cellulose in human muscle. This is the muscle. Okay, then you can see here pig. Pig is going to feed on all the kachara, feces, and pig will get affected. Now pig is intermediate host. So in the duodenum of the pig, the embryophore ruptures, right? In the duodenum of the pig, embryophore ruptures, oncosphere is released. This oncosphere penetrates the wall of the intestine of the pig. Then here, this is the Cysticercus cellulose in the pig muscle, which man is going to consume now. Very good. Now let's move on. Pathogenicity. Wow, finally we reached pathogenicity, is it? Okay. Intestinal taniasis is caused by both Taenia saginata and Taenia solium. The adult worm actually will be having no clinical features. So pathogenicity means you have to write life cycle also, guys. Don't forget the diagram that you saw here. Pathogenicity means you should draw this diagram also. Now the symptoms, what and all symptoms can a person have? Very easy. Touch your stomach and say abdominal discomfort, indigestion, nausea, diarrhea, weight loss, right? Diarrhea definitely will be combined with weight loss. Then acute intestinal obstruction can be there. That is because of these worms, I think. Intestinal obstruction can be there. Appendicitis, pancreatitis. So sad. All because of the stupid worm going and living there inside us. Now coming to cysticercosis, let us look at the clinical features of cysticercosis. Okay, so cysticercosis is caused by the Cysticercus cellulose of Taenia solium. That is the larva, correct? Just make it a little more visible for you. Hold on. Let's look at the first 3 points here. So cysticercosis is caused by the Cysticercus cellulose, that is the larva. That is the larva of Taenia solium. Here, this Cysticercus cellulose may be solitary or often multiple. Often they'll come multiple, so many will be there. They'll affect the subcutaneous tissue. Touch your skin and say subcutaneous tissue, there will be Cysticercus cellulose, and it will always muscles, very important. Now this tapeworms, they go and sit in the muscles. You have already drawn the diagram in life cycle and seen all that. Then moving on. What else it will affect? It can affect eye, brain, heart, liver, lung, abdominal cavity, spinal cord. Touch each of this part and say eye, brain, heart, liver, lung, abdominal cavity, spinal cord. What is it leaving? Central nervous system itself, it hit with the brain and spinal cord. Okay. Now moving on here. Cysticercus surrounded by fibrous capsule. So usually it is surrounded by fibrous capsule, the cysticercus, but it is not surrounded by this capsule in the eye and the ventricles of the brain. Now look at the look at the cellular reaction. This is more like pathogenicity, right? We'll come to this part later. Now, there is cellular reaction. There will be, what and all will come here? Neutrophils, eosinophils, lymphocytes, plasma cells, giant cells also can come. Remember this eosinophils, right? Always eosinophils are more in these kind of worm infestations, like hookworm infestation also you have seen eosinophilia, right? So, Taenia also can cause increase in eosinophils. Then, finally what happens because of all these cellular reactions, there will be fibrosis. Fibrosis will, then what will happen? The tissue will die because of calcification, right? Then what will happen? The larva also will die. We should mark in green actually. It will kill the cells, fibrosis, calcification, then larva itself will die. Nice, no? Now, how many people are sleeping and how many people are understanding what we are trying to explain? We finished the pathogenicity of this cysticercosis, okay? Now, let us look at the clinical features of the cysticercosis. Hold on. This actually is cysticercosis, what we have done now. Pathogenicity. Now, let us look at the clinical features of cysticercosis. Now, clinical features. Look at this. One second, just one more second. So, clinical features, guys, subcutaneous nodules. So, just now you touch the skin, right? Touch again and see. Subcutaneous nodules are there? No. But they are there also, they are asymptomatic, okay? Nothing much to worry about there. And then coming to muscles, it affected the muscles, right? In muscles, what will happen? Acute myositis. What is myositis, guys? It's nothing but inflammation of muscle. Okay. Then neurocysticercosis, see, it affects the brain. Oh my God. It can cause epilepsy. Sometimes when suddenly somebody gets epilepsy and they never had episodes before, it could be because of these worms, these larvae of Taenia solium. Remember, okay. There will be increased intracranial tension. Obviously, right, the larva is in the brain, increased intracranial tension only will be there. What else will be there? Hydrocephalus, psychiatric disturbances, meningoencephalitis, papa. Transient paresis, behavioral disorders. Suddenly this person became mad. Why? Because of all these worms. Right? So, usual, what else? Epilepsy, let's see. Then, aphasia means difficulty in speech, right? Visual disturbances, papa, again. Second most common cause of intracranial space occupying lesion, that is ICSOL, after tuberculosis. The second most common cause of intracranial space occupying lesion. Whatever space is there, who will go and occupy? Tell. These worms only. Intracranial space occupying lesion after tuberculosis is the second most common cause. How many people are understanding cysticercosis clinical features? Everybody understood or everybody is sleeping? Okay, you understood? No? Good. Let us move on. Ocular cysticercosis. Ocular cysticercosis, obviously, eye also it is affecting. That time you touched the eye, right? Yes, so ocular cysticercosis. Cysts are there in vitreous humor, subretinal space, in the conjunctiva. Obviously, what will happen? Blurred vision, loss of vision, iritis, uveitis, palpebral conjunctivitis. Right? All this, guys, in the exam, don't forget. So, we are done with the clinical features. Next, what is there? Lab diagnosis of teniasis and cysticercosis. Separately, we'll handle them. Okay. Are you awake? Is it going over your head? Is it fine? Shall we move on to lab diagnosis? Okay. So, teniasis, let's look at the lab diagnosis. Easy stool examination, serodiagnosis, molecular diagnosis. This you have already seen the headings we have mentioned earlier only in the overview, correct? So, let's look at the details now. I think we will take up the lab diagnosis in the next video, okay? Come back for the lab diagnosis of Taenia, intestinal teniasis and cysticercosis lab diagnosis next video, okay? Then, that's all. So come back, okay, for the next video. Bye bye. Enjoy.